LATOMS is a Montreal network of 31 organizations that works on prevention or services for HIV, AIDS, people living with HIV or just in prevention. And there's also all the harm reduction side of it, because like giving needles and stuff like that is in fact not STDs, but STBBs prevention. So yeah, I'm in charge really of the overdose prevention side and files.
Okay, no, it makes sense. It makes sense. I've covered overdose related subjects before, so I understand. Okay. I just kind of wanted like a little understanding, just so I won't use your introduction. Like I'll be on. There'll be moments of me on camera explaining things, so I kind of wanted to know how to introduce you properly.
Yeah. So yeah, really, I work with the organization that are members of LATOMS to help them offer a better response to the overdose crisis. So everything they need, I'm just trying to just make it work, or yeah, while working together, so they don't work just by themselves. And
okay, that makes sense. Thank you so much for explaining that. So I guess I'll go to the first question. How did you see users being impacted by the last curfew?
Yeah, so people who use drugs were heavily impacted by the curfew, but also by the sanitary measures in general. So a lot of them were forced to use alone, and the drug supply was impacted, and we saw a lot more fentanyl and benzos and different substances, while some others were harder to find, which changed their using habits. A lot of community organizations had to reduce their services too, causing more isolation. And we saw and still see a lot of psychological distress. And we think, we think it might increase the sexually transmitted blood-borne infection rates, since the access to syringes and condoms was harder. But then again, we still don't have the data, but yeah, that's that's something we think is a consequences of all those measures. And also, when everything is closed after a certain hour, this means people can go anywhere to warm up or spend the night. They can't buy food. They can't even buy a lighter. I mean, everything is just shut down, and it makes it harder for the street economy, like sex work, panhandling, picking up cans and stuff like that. Those activities were affected by it, and making money was and still is a lot harder or risky, and even impossible for some, which means they have less money to live.
Okay, that makes sense. Thank you. I had one question just on something you mentioned. The psychological impact. Would you be able to speak on that a little bit more?
Yeah, well, I mean, being isolated and, well, times are stressful for everyone right now. I mean, it's not an easy time to be alive. So marginalized people are, again, more impacted by that. We see, a lot more depression, suicidal thoughts. Being alone is harder. Being more poor is harder too. So those are all the things that can affect your psychological health. And yeah, I mean, the streets are more violent. You see, well, I don't know if you remember, but last year when nobody was in the street, the only people you saw were majorly people in the streets, like homeless people. So they're more visible, which comes with a lot of struggles and challenges too. So yeah.
Thank you. What was my next question? I know you already kind of answered this, but I'm just kind of asking it again. Maybe just if you could provide some more details. Does isolation caused by the pandemic and the curfew in particular play a role in overdose rates that we've seen over the last year?
Yeah. It's hard to tell, but I think it does. Like, we don't have a lot of data on it right now. But as I said, isolation is hard for mental health, but it's also against harm reduction principles. We recommend not using drugs alone, but in this context, it's impossible for many. So if you're overdosing and you're alone, nobody can intervene, call 911, give you naloxone. So yeah, so there's a risk of more deadly overdose. And yeah, as I told a bit about it, but mental health issues and psychological distress experienced by a lot of drug users might also increases the risks of overdose, either because they are using alone, because they're using different substances than what they're used to, or because they're just like taking more risks while using, because they're not on top of they're not top shape. And yeah.
Like access to clean needles, things like that.
Yes, that, or using, like, hiding yourself because you don't want to be seen, because you can't use I don't know, where you live or in the streets, or all those risks.
Okay, so that if someone is experiencing an overdose and they're hiding themselves, no one is there to assist, essentially.
Yeah, exactly.
And then I just wanted to confirm something at the beginning when you said that the drug supply is being affected. Is this due to border closures or former border closures?
Yeah, well, I think it has it impacted that a lot, but I can't tell for sure what happened. But I'm pretty sure the borders being closed was yeah, contributed to that.
Okay, not a problem. What else? So this isn't something I actually look to confirm, but I'm certain that safe injection sites, they're not open during the curfew. Is that right?
Yes, they are.
Okay, they are.
Yeah,
Does the
because
curfew?
they're considered like as essential services, so it's still open.
Okay. Do you think that the curfew still affects this in any way? Maybe someone who doesn't want to go to a safe injection site because they could be caught walking on the way, or are they exempt?
Yeah, yeah. Actually, last year we saw a very lower frequency of those services. This year, it's still early to say. I mean, there was like New Year, the beginning of the month, and it's still pretty new, the curfew for this year. So I'd say it depends on within which communities or in which neighborhoods, because there's a few safe consumption sites around Montreal. But what I can say is that the police presence is an element that affects the frequency of those services. The more police in the streets, the less people will go in those services. We did distribute, well, the people working in those services distributed last year, and they still do this year, attestation, like for the policing, that they're allowed to be in the streets after curfew to go there. But it's still risky, yeah. So, I mean, you have to disclose why you're outside at that time. So you have to say you're using drugs. So it makes it easier to control the identity of marginalized people with all the associated risks, like having an active warrant under your name, being searched and caught with drugs. So yeah.
So say for example, I wanted to go to a safe injection site between 10 to 5 a.m. And a police stopped me and I said, oh, I'm going to the safe injection site. Have they been directed not to interfere, or is it kind of up to whatever the police officer decides?
I'm not sure this year. I think they should like allow people to do it, but that's why there's the paper that we can give people, so they just like have a proof that's what they're doing. But I know last year we heard about people like having those papers and police just saying like, we don't care, so and just ripped it. And yeah, so it happened last year. I don't know this year yet. Didn't hear about anything about it.
Okay, that's good to know. What exactly do these papers say?
Well, I don't know, I haven't seen them, but I guess it says that the person frequents the organization like Cactus or Dopamine, which are open during night and are safe consumption sites. And yeah, so it's just like a permission to be outside because they're going to use the services.
That makes sense. Thank you for explaining. Yeah, did you, okay, so you did mention that overdose rates increased last year. Did you come across maybe any specific numbers that showed a spike during the curfew or anything like this?
Yeah, well, it's always hard to tell because we don't have the real numbers, mainly because it takes like years sometimes to have the coroner's reports and the official numbers. So we have numbers for presumed overdose death, but that's not confirmed. And there's also many overdoses that are not reported or even counted as overdoses for many reasons. So yeah, it's hard to tell because we don't have actual full and real numbers. But yeah, we can see on the INSPQ or La Santé, the Montreal Public Health, they published some numbers, and we see like that there's some peaks between March and May, principally. And also we heard like in the community organization heard a lot more about overdoses that happened in the community, not necessarily in the safe consumption sites, and not necessarily reported by public health because nobody called 911. They just like gave naloxone. But yeah, that's something we hear about a lot.
Okay, good to know. And then the last thing I wanted to ask, I didn't send you this question, but I was just thinking about it as we were talking. Just in regards to what you said earlier about, with isolation, sometimes there's more increased consumption. Is there any way we can know how there's been more consumption, or it's more just kind of hearing from community organizations?
I don't know. What I'm talking about is, what I hear from community organization, with the people in the community. So it's really self-reported, but I don't know if at some point we will have data on that, or if there will be researches or anything, but.
Thank you so much. Is there anything that I didn't ask that's important to keep in mind?
Well, I don't know. I'd say that we don't have enough, as I said, we don't have enough data to know if it's really associated with the curfew, but I think it's safe to say that the overdoses and all that psychological distress can be attributed to the pandemic and the sanitary, but also the repressive measures that are in place right now and were in place since the beginning of the pandemic.
Thank you so much. And I get, sorry, one last thing, I don't want to keep you for too long. But just as you mentioned, kind of repressive measures, do you have any specific thoughts? And maybe this kind of relates to the war on drugs, but as we've seen since the beginning of the pandemic in Montreal, there is a lot of heavy use on over policing. I feel, I mean, just my personal opinion, what I've come across doing reporting is that the government really does heavily rely on increased policing to, limit gatherings, limit the spread of COVID. And just for drug users, do you kind of have any statement on how this could be harmful and, kind of, I guess, increase stigma?
Yeah, well, as I said, I think they're really trying to police the pandemic, which is harmful for everyone, but majorly for marginalized people. And I think we see right now that having the right services and more services for people who use drugs, mainly, is really important, and that, I don't know, I can't I can formulate something like really well at just a minute. Yeah, well, policing the pandemic increases stigma around marginalized people and drug users.